I always look forward to our conversations, even though we have a rather grim topic today. So, first of all, Richard Wolff, welcome back to the program.
Really glad to be here, RJ, and I think there's importance in that grim topic. So let's go ahead and do it anyway, despite the grimness.
Yeah, I think I feel we should. It's about the story of the day, and bearing in mind that we're recording this on a Thursday, it'll take a couple days before most folks see it or hear it. And the big story of the day is the shooting of Brian Thompson, the CEO of United Healthcare. This is obviously a personal tragedy, a terrible story for him and his family. And as I was telling you, Richard Wolff, before we recorded, I'm pretty sure I met him many years ago when he was new to the United. And I looked back, and it seems very clear that I could have and would have. Very nice man, by the way, on a personal level. But the story has many implications as we speak, as you and I speak. Of course, they haven't found the suspect. They don't, so they haven't ascertained for certain a motive behind it, but there appear to be, as we speak, clues, particularly that two of the shell casings found at the scene had, one had the word delay and one had the word deny. Both terms are used by insurance companies like United Healthcare to refer to the utilization review process, as is called, a pre-certification, where delaying and denying medical care can have very adverse, sometimes fatal effects on people who are powerless over this process. I mean, they can try an ombudsman, they can try appeals of various kinds, but a corporation like United Healthcare has enormous power with words like delay and deny. People's lives can actually be deeply affected. So that leaves, the idea that this might have been a shooting in revenge, perhaps, for something that United Healthcare had denied for a loved one or whomever, or it could have been a political statement. Even the notification from the New York Times that I read said that the words have multiple meanings, although I think if you put, so they're not sure, which, okay, they have to qualify that, but taken together, I'm not sure how many other meanings they have. And even in this a delicacy of the moment, the New York Times added with a link, United Healthcare has come under fierce criticism from patients, lawmakers, and others for its denials of claims. And I've long said, I've worked in that field for many years. I've long said that they make money by not paying for medical care. That is the business model. So to me, Richard Wolff, sorry for the long introduction, but I wanted to give a backgrounder. To me, there are multiple issues here. The public response to date to this shooting, the forces that might be behind it, and so on. So I wanted to bring that to your attention and see, first of all, initially, what your thoughts are.
Well, I understand that the wires are buzzing with social commentary on social media networks, and that a large part of the commentary from all corners of the United States are about what you just said. In other words, it's people who are interpreting, let's use that word, interpreting what they know of this event within the framework of a clearly accumulated bitterness and anger at experiences these individuals have had with medical insurance. I'm going to put on my economist hat. It doesn't fit all that well. I don't look good in it, but I'm going to wear it for a moment anyway. And I'm going to say, this is clearly a conflict of interest, and it's always been. The thing you just said at the end of your introduction is the conflict of interest. It is dangerous to put the decision about how much care you get and when you get it into the hands of an entity, a corporation, which tells you its raison d'etre, its chief goal, its ultimate target is the maximization of profit, which we know it has to say and do because that's the way capitalism is organized. And it will be destroyed if it doesn't conform to the system. But then, of course, correct, you want to do what is necessary to get the person to sign up, or the employer, if it's an employer plan, to sign up for the medical insurance. And then you want to spend the least amount of money to provide what you have gotten the premium for. And unfortunately, that means if you can delay coverage, well, then your money in the bank is earning interest before you have to pay out for the claim. And if you can deny the claim, well, then you don't spend any money. It was, I'm sure, not connected, but it was very interesting that on the same day that I read that story in the papers, I also read an associated story about, if I've got it correctly, Anthem, that's the company that took over Blue Cross Blue Shield, which has now got itself into a big controversy in which I believe also members of Congress have weighed in, because it has proposed uh, a new rule going into effect February 1 of the coming year, that's less than 2 months from now, in which they will allot a certain amount of hours of anesthesia for persons going through surgery. I mean, at first you start to laugh. What? You know, they need to, and they say apparently it's to limit the amount of money flowing out to cover the costs of anesthesia. Well, there you have it. For them, anesthesia is a cost which they wish to minimize. For the doctor and the patient, it's a necessary part of the surgery, which may or may not be life-saving, but which requires anesthesia. We're allowing a private corporation telling us that it trying to save money be the final arbiter of whether or not they pay for what it is most of us believe we have when we say we have health insurance. It covers, by the way, as it always has, the anesthesia needed, in the opinion of a doctor and a patient, for a surgery. I mean, you take a step back from a story like that, and you don't know whether to laugh or to cry because it is so unspeakably obvious that this should not be the way a health insurance functions. Either you're insured or you're not, but otherwise you're in a constant struggle around this central conflict of interest. How much have you paid them? And how much do you get from them for what you paid? And I can tell you personally of hundreds of conversations I have had in my lifetime in which people have told me, both medical practitioners, doctors, and so on, nurses, and regular folks who were patients, of having endless struggles, sometimes lasting years, in which they fight with an insurance company. And the doctors tell me this story, and just regular people. So I know it's true. I know it's a constant battle, and that there's things being done under the radar all the time that you don't discover until you have a medical emergency of one kind. And you can't be all that concerned about insurance because you're trying to get through the medical emergency. And in the middle of that, they make a little decision. And instead of your being billed $280, it's $28,000. And now you have the beginning of a fight that is unequal. It is you versus a battery of lawyers hired by that health insurance company who have gone through this experience 50 times, who are experts at knowing what the rules say, don't say. Yeah, you can look at your insurance. It runs 40 pages of very small typescript, and you can try to memorize it, but it's as unfair a fight in the law case as it was in the initial situation of the policy you have and the benefits you don't, in fact, have. It's horrible. It's one of the reasons the public in polling indicates tremendous dissatisfaction with the health insurance system that we have.
Well, it's horrible. It's uniquely horrible when compared to other systems. The analogy that I use sometimes, Richard Wolff, is what if I had an emergency fund? I was just setting aside a few bucks every paycheck for emergencies, but instead of putting it in a safe or even relatively speaking, a bank would be better in this case than a health insurance company. Instead of doing that, I gave it to you. And I said to you, Richard Wolff, here's all my savings money for emergencies. What you don't give me when I have an emergency, you get to keep. And that was the deal. And my car breaks down and I say, hey, I need to buy a new car. No, you don't. You don't need a car. You just got yourself some money. Or I'd run out of heating oil and it's winter's coming in. I'm going to freeze to death. You don't need heating oil. And that is the
Yes.
model for the health insurance system. And we have a working, successful, relatively successful model of social, the concept of social insurance, collectively insuring each other as well as ourselves. We have Social Security, which is the benefits should be greater, but it is a working social insurance program. We have Medicare, again, too much of this private sector stuff in it, but a working program. And yet we ignore these functional programs and drive ourselves and others into this lunatic system. And frankly, I've been hesitant to say this, but whether it's bankers or whether it's health insurance executives, which I suppose technically I was myself at one point, and again, we don't know the true motives here, but I'm candidly surprised that there hasn't been more of this and that it didn't start sooner. When I was writing about Wall Street criminality 2008 through 2012, that was my big beat. And I'd get these comments, what's so and so's home address? Because we're going to go hang him, those kinds of things. And I'd have to say, look, no, it's not how we do things. But there's been this nascent anger all along, and it's reflected. You mentioned social media. I wanted to clip a couple things for you. Earlier today, United Healthcare issued a tweet expressing sorrow at the loss of this executive, of course, and concern for his family, as you might expect. At the time that it was sent to me, there were 1,700 expressions of, I guess, shock. This is using emojis. There were 2,000 expressions of grief, and there were 23,000 expressions of laughter. That shows how profound the anger is out there. So I guess I mentioned that just to say we've got a furious electorate, our population, citizenry. I doubt that breaks out very much along, what are described as left-right Republican Democratic lines in the political commentary. I think people are just really pissed off, and they see this guy without, certainly not without reason, as being part of a deathly system. And I'll read you one more, and then I'll go, because I think this one actually, it's not in me to say something unkind when somebody dies, even, but somebody named Kylie Chung said something very smart. First, she said, health insurance executives kill people every day, but by denying them coverage, by the way. And then she said, and this I thought was important, Rick Wolff, and I'd love to get your thoughts on it. The way we're socialized to see violence only as interpersonal, and not to see state violence, policies that create poverty or kill, structural violence, institutional violence, is very deliberate. It's the same with panics about shoplifting versus how much corporations steal from us and every single one of us. Again, I don't mean to take away from the grief of this gentleman's family or what have you, but I thought that was kind of on the money, so to speak. What do you think?
Yeah, I could not agree more. And I do see an even darker side to all of this, but I want to bring it up because I think it's real. I think we are in a period of history in which problems that arise that are difficult to solve are inviting those who are in conflict to think and to use physical violence as
Hmm.
a way of solving them. Ukraine and Gaza are obvious examples, and they are both horrible. And particularly in Gaza, it strikes me as outstandingly horrible. I mean, the International Court of Justice sees genocide and issues arrest warrants. That's a sign of something because it doesn't happen very often. The same court issued the arrest warrant against Putin in Russia, not on genocide, but on being a war criminal, and how different is that? But my point is, violence is more and more being talked about and being utilized. Uh, and I think what you're going to see is that it's utilized on the objects that people are in conflict about. And those 28,000 tweets or whatever they were, comments in social media, tell you that there's a lot of accumulated rage and anger and bitterness. And given what the United States officially does in the support of violence, the whole world is aware, including Americans, that the violence, for example, in Ukraine and Gaza, is paid for, and the weapons doing it are provided, at least on one side, by the United States. We are participating in a violent or an attempt to use violence to solve problems around the world or to enable others to do so. And okay, that's going to lead people what to think about doing something violent around their grief. And if their mother or their sister or their child had their coverage delayed, meaning that in addition to whatever the crisis of health was in the family, they now have an additional crisis of finance because of non-cut. This is asking people to bear life-changing, negatively life-changing experiences and not think about hitting back. And by hitting, I now say, given what we're doing around the world, the use of violence. And like you, I guess my bottom line is I'm surprised we haven't had already more of it. And I have the sense that we're going to get more of it unless and until something is done about this kind of social or structural or state administered normal routine violent abuse of people. Eventually they figure it out and eventually they push back, and we are courting that disaster. And this what we've just seen is, I think, a signpost along the way.
And it seems to me that it's not just the helplessness that people, or not just the injustice that people experience, it's their sense of helplessness, their inability to do anything about it, the utter powerlessness. I've been told that for a leftist, I'm unexpectedly kind in my assessment of Trump voters or MAGA people or whomever. And if that's true, I don't know if it is or not. I mean, I think it's because I understand how frustrating it is to feel absolutely powerless when you're being mistreated and pushed around, and even, your health damaged, your loved ones dying, or whatever. And it strikes me that I wonder to what extent the absence of any major movement fighting for more justice, much less political party fighting for unequivocally for justice to change this broken system and so on, it makes that feeling of helplessness worse. I mean, maybe I'm reading too much into it, but it seems to me if someone has lost a loved one, let's say, or had their own frustrating experience with this is ghastly Kafka-esque life-endangering system, that if they knew they could join the X party and, fight for movement, fight for a better system, maybe there'd be less inclination to violence. Maybe there'd even be less, as they call them, deaths of despair and addiction and drinking, whatever. But it seems to me that suicides and so on, it seems to me that our system right now offers no channel for turning this anger into productive activity.
You know, all I can tell you is my own life experience reinforces that. A part of my family is French. And when I go back to France to visit and so forth, and I talk with them over the years, I've asked them about their health insurance system. It just comes up as a conversation. And they have a very good one, or at least my relatives. Uh, it basically covers you from the day you're born to the day you die, whether it's an injury or an illness. You're covered. Being a French citizen gives you that coverage. I don't know whether it extends to documented immigrants, undocumented. I don't know how that's handled. But if you're a French citizen, you get this kind of coverage. So I've asked them, well, from your perspective, how do you explain? Because I know how I explain it, but why don't we have in the United States, where I'm a citizen, something equivalent, more or less? And their answer has always been because in this country, we have the Socialist Party, the Communist Party, and then they list three or four others because France has quite a few political parties. And she says they're the ones who brought it when they had the power. Social Americans, I have to always say this. In France, folks, socialists have been the government many times over the last 75 years. So when they were in power, they instituted it. And then they said with a smile, once it's in, and once people see what it is, and once they compare it to when it wasn't, no one, no right winger, no centrist would dare indicate hostility to that because they would be voted out. One of the few reasons the Labour Party in England didn't die was because it had the credit for the National Health Service there. And despite the efforts of the right wing to starve it of funding and to do all the other things they've done to it, it's still there, and the British people rely on it. And they're not going to go for a political authority that takes it away. But again, it's the same nickel and dime mentality. If that can be done by a government bureaucrat as quickly as is done by a corporate executive, if the logic of the government agency is to save money, then they're going to end up behaving. The model is, after all, private enterprise, which unfortunately the private sector wants the government to be like that, and then the people are left with nothing. But some of the nastiest words ever to come out about the American Health Service, in my experience, is what people say after having been denied or delayed coverage, and then making a claim that I shouldn't have been denied, I shouldn't have been delayed. Then what these companies have are unbelievable mechanisms of delaying and denying the claim and taking a long time to do it. And even having officials who remind you that you better not get nasty because we're the ones who are going to decide whether or not you get the. In other words, you literally are boxed in by the authority that is letting you know your survival financially, medically, is in their hands. And they are interested in making money. You are of no importance.
And I'm going to add, just for a little seasoning to this conversation, Richard Wolff, I'm going to add another group of miscreants to the conversation. And that is some of your colleagues in the economics profession, as well as policymakers and people in my former line of work, the financial side and all that, administrative side and all that, uh, which is uh, to have a worldview, a kind of vision of reform, like the reform that provided the Affordable Care Act, um, that is a mirage at best and a deception at worst, and is based on, in my view, delusional ideas. I'll give you an example. I'll give you two, actually. One was when I went into the world of HMOs, designing computer systems for them and so on, and I was very young, and the HMOs themselves were relatively new. It was considered a progressive thing, a liberal thing, health maintenance organization. For a certain fixed sum of money, you could do good by doing well or do well by doing good because you kept people healthy. They didn't get sick. And then people figured out, no, you don't have to keep people healthy. You just don't pay for anything when they do get sick. That was delusion number one. Delusion number two, I remember sitting in I won't name the foundation, but sitting in a foundation skyscraper headquarters in Manhattan, a team of people talking about potential health reform, and all the health economists were in agreement that the mandatory premium to be paid to private healthcare insurers, like the one we're talking about, should amount to 10% of household income. And I tried to say, wait a minute, if you're trying to raise, let's say, a family of five in Queens on $75,000 a year, that let's say, and then not poverty line, above poverty line, you think it's okay for people to pay, be forced to pay under penalty of law, $7,500 to a company that will A, force them to pay another 5,000 out of pocket before they get coverage, and B, will fight them everywhere on the coverage they get. Well, why not, they would say, you know? I mean, this was just assumed. The whole process was so divorced from any kind of real world experience. 10% of income. For you, it might not be a lot, but for, most people, it's a hell of a burden. And so people say, well, there are X million uninsured in the United States, X percentage uninsured. I say it's 100% uninsured. If you're talking about under 65s or underinsured, people don't have the money to cover they say they don't have $1,000 for emergencies. The deductible is 2,000. You don't have to study advanced math to figure out they're not, protected from catastrophe. But to me, the liberal reformist psychology and the economists and other experts who fund who give it its intellectual fuel, to me, they're guilty parties in this too. What do you think?
Absolutely, because for them, they're just trying to placate. They feel good that they're going to provide health insurance, and so they keep the private medical industrial complex happy by saying, "Okay, we'll sock the public for 10%. Do your work for you by setting this system up to literally deliver you this flow of revenue." And you're absolutely right. The logic then is, if our revenue is fixed, then the profitability becomes, how stingy can we be with the coverage? The more we delay, the more we deny. It's literally a dollar in my pocket. And I think that what we have also is, if each of the players in this game, the doctors, the hospitals, the drug and device makers, if they were all really independent of the insurers, then there would be more of a tendency for them to fight one another and to look at the flow of money for healthcare as an entity, and then how does it get divided up. But they very cleverly understood what I just said. And so from the beginning, they agreed we are together going to get more money coming to healthcare. And we'll do that because we'll combine lobbying and public pressure and social influence with the politicians. Don't let them imagine we can fight amongst each other. So the insurance is, to go back to our example, the insurance for the anesthesia is expensive. So Anthem, Blue Cross Blue Shield, okay, we just won't cover as many hours of anesthesia as we used to, and that'll be a reduced outflow of money from us. At which point you can say, well, wait a minute, if you're spending too much, why don't you reduce what you give to the anesthesiologist? In other words,
Right.
you're taking as given that they have to get, $612 an hour for what they do. Okay, you and I both know you could give them $500 an hour or $400. First of all, they're among the highest paid professionals in the country, so we're not exactly going after people who have a hard time. And we're also paying wild amounts for drugs, as we all know, and wild amounts. But part of the reason the wild amounts are there is because the insurance companies, being part of the complex, don't fight with the underlying. That's a taboo. We all help each other. Otherwise, of course, we'll be at each other's throats. But the whole logic of private capitalism was supposed to get us that result. We were supposed to have capitalists competing with one another. What they've done is created a monopoly, or strictly speaking, of their connected industry: hospitals, doctors, drug and device makers, and insurers. And by acting in concert, never quarreling publicly, privately, who knows, but publicly, they have been able to be a united front, avoid socialized medicine, and achieve growing profitability across their range of activities by sticking it to the public, either overtly by charging more money or covertly by cutting the coverage. It's not a complex game. It's very obvious. Even the limited legislators we elect would understand this if you spend half an hour going over it. So it's only the power of that medical industrial complex. For me, it's more devastating to the daily life of Americans than the military industrial complex from which it takes its name.
Well, I read a paper by Steffi Wohlhandler and David Himmelstein about both physicians, among other things, estimating, and this was many years ago, 69,000 Americans died every year because of lack of health insurance, which, as I pointed out at the time, was I forget now the math, but 330 9/11s, something like that, and or 33, I don't know, but it's a ton of 9/11, and that was many years ago. It's gotten worse since then. So we've had hundreds of thousands of people killed by this system. That's the structural violence that the person on social media was talking about. And we're told, in closing, I'll just say, I guess we're told it's impossible to get public health insurance for everyone in this country. It just can't be done. All it takes is what, 300 people on Capitol Hill, and we'd have it.
Right.
It's not impossible. You just got to pass the laws that make it possible. That's my closing thought.
Also, no one, I mean, I may be wrong, you know the literature better than me, but no, it has never come to my attention a serious effort to say, if we had national health insurance, and if it really meant you could go to a doctor when you feel you need it and be seen and all the rest, what the savings would be in all the other areas of society. How many sick days would no longer be lost in production enterprises? How many public services would be accessed less if you had that kind of cradle to grave uh, healthcare? It's just, for me, it is a wonderful example how the ideology trumps all the rest of it. This is a country that claims to believe in evidence-based judgment, and it's never made the effort it could make to come up with some serious estimates about what it really costs. Will it be an extra 20 billion? Yes. But how much of that will come back in savings? Not to
There
say that.
have been there have been studies, not in a while, but when Bernie was talking about this, there were studies, including some of your former colleagues at Amherst have looked at it. But the problem is, even the best of them don't factor. My criticism has always been yours. They don't factor in productivity gains from a healthier workforce. Not even getting to some of the intangibles. People who feel better will do more. They'll contribute. They'll be more productive. They may consume more as they go out there and visit national parks and go to movies. But none of that is factored in, and that is exactly that's exactly been my concern. That they've done good work, but if we widen the lens to its broadest aperture, we're starting to talk about maximizing human potential and
Well,
uh,
my
uh,
let me, if I may interrupt, my French
sure.
family that I referenced before, they loved, because it was a bit of a teasing of me as the American, they loved to say to me, "We don't save money." Why? Because we don't have to worry if we get sick. You people save money, so you have a rainy day fund in case you get hit by a car or you get a cancer or whatever. And the other thing is, we don't save money for the university because the university is free. And they had two children, both of whom went to the French university system. You know, in later years, their children, when they had children, they were also subsidized. I remember sitting there with my wife, listening to their explanation. They live in the middle of Paris. They can send their kid to a public daycare, which they do, uh, as early as 7 in the morning, pick them up as late as 7 in the evening, or any segment within that, 6 out of the 7 days a week, every day but Sunday. And it cost them $21 a week. I mean, it's a joke. It's complete. They don't have to save for college. They don't have to save for medical emergency, and they don't have to save to take their kids daycare. Which, since both of the adults work, they have to have some form of daycare. Well, those are some of the major reasons why people save. And as an economist, if there were a shift from consumption from saving, excuse me, to consumption, because we did this, that would have to be factored in to the jobs that creates, to the growing output it's just, it's incredible. It's incredible that these decisions are made because a medical industrial complex can charge Americans more for their health care than that of any other population of an advanced industrial country, much more, and then use a significant part of that excess cost to subsidize the advertising and the promotion to the public and to the politicians that keeps this absurd system. The only thing that made it worse in the last 3 years was that, unlike every European country, longevity in this country is going down, whereas there people live longer, itself a consequence of the quality of the care that you get.
We could go on like this
Yes.
forever, and I'm sure we'll pick it up again at some point. But I certainly hope that we will soon be, and I think you and I are devoting ourselves to as reframing the discussion enough that people don't feel this immense frustration and hatred, but can
And
channel.
ironically, to get back to the grimness, this conversation and facing these realities is one of the few ways you might turn the otherwise tragic event into something positive, that it'll force us to confront why people are so dissatisfied, as we know they are, whether or not that turns out to be the particular motive of this particular act.
Right, right, absolutely, and let's hope that it has that positive outcome for a personal tragedy.